Today on the Fit Dance podcast, we're joined by the owner of Down2U Physio, Adam Sui. He's an occupational, musculoskeletal and pain physio, a dad, a husband, and one very strong lad. He's passionate about teaching those he works with to live pain-free, and with his understanding that the body has the capability to heal and improve at any age. His mission is to provide the most appropriate advice, treatment, and exercise for you to help yourself. Because in his words, movement is medicine. So welcome to the Fit Dads podcast, Adam Sui.
Thank you. Thank you for having me.
Awesome stuff, mate. We'll just talk about your Instagram and how cool it is, some of the amazing stories we see come out of there. Was it the one about the stroke you were talking about? That was quite a cool character. Talk to me about that guy.
Jermaine, I don't know if I should have said his name, but Jermaine is 2 years post-stroke. He's got left side paralysis.
Yeah.
And he's a dad also, and just struggling to get the motivation back to live his life the way he wants to live. He was a chef before, and he just wants to try his best, but he's been banging on so many doors that he's been struggling to get the right rehab to push him in life outside of the rehab centre. So, for example, he's going to the NHS. There's 2 kilogram weights there, and it wasn't enough to challenge him in that way. And so, seeing him progress in all his movements, walking independently, deadlifting 85 kilograms.
Wow. Post-stroke.
Post-stroke, yeah, 2 years down the line. And we initially started it on a box, just like trying to deadlift from the box. But then he looked all right, so he was like, shall we try standing? So he just did it in standing. He tried it the first time 2 weeks ago. He managed 55 kilos. And then 30 kilogram jump in 2 weeks. And is that belief? Is that strength gain? It doesn't really matter as long as he's feeling more confident in himself.
What I love about your approach is, because I've only been following you a few weeks, maybe a few months since we first met at the networking event in Sheffield, and I just really like how hands-on you are, how practical you are, because so many physios are very cautious about deadlifting and squatting, but your Instagram's full of people who they've got issues, they've got things they've been through in life, and you're really forcing them to kind of, do more, be more, get stronger with some quite, what will be kind of classed as maybe, what's the right word, maybe impactful exercises, things that you wouldn't normally get, most physios wouldn't get people doing, let's say.
Yeah. So I call it functional rehab. So getting them fit inside the gym will get them fit outside the gym. For example, why would you want to deadlift? To pick your grandkids up, or pick your kids up, or throw your dog around, or whatever it is.
These aren't like things like, these things weigh 10, 15, 20, 30 kilos. They need to be able to lift these things.
Not only just for 15 kilos, if they can do like 80 kilos, then they know that they're able to do that many times rather than just the one time. So the functional rehab side of things is super important for me, because we can give the advice all day. Like, you can start lifting, you can bend from the back, you can move and lift things. But if they've got pain, then they might not take that step to trust themselves to do it. So when they've done it with me a few times, I've done it in the gym, so I should be able to do it outside of that as well.
Why do you think a lot of physios are maybe a little bit cautious when it comes to being more tentative and not having them deadlift, squat, doing things that could potentially cause them some harm? Even the NHS, why do you think they've only got 2 kilos available to their kind of patients?
One may be, their expertise in terms of doing that. 2, it is potentially injury provoking. So it's that worry of injuring them whilst they're treating them, to then obviously lose that trust. But because obviously I train and I see it a lot, I have that confidence to push them to the max, because they're still doing the lift safely. They've got all the bracing, all the breathing that I've taught them. But most importantly is that I do actually want to trigger a flare-up, because we'll put all the stuff we've learned before into practice, and does it turn it off immediately? And if they get a sense of immediate improvement, it's like, if it happens to me outside of that environment, I have a spasm from picking up my kids or picking up some socks or getting changed, then what do? Right, I'll do the techniques that I've learned through Down2U.
And how quickly do they recover as well? Because I'm sure in the past, when they had a flare-up, it will be weeks, months that they were out from being able to move properly, train potentially. Can they recover quicker? That's a big thing for people. When they get a flare-up, are they able to kind of within a few days go back to what they were doing before?
Probably not go back to exactly what they did before, but I at least stay on track. So consistency is key, and I think we know that if you've been out of something out of a few days or in a week, you can lose that habit. So then it's just allowing them to still tick along, understand they still can lift, maybe not 100%, but 50%, and move from there. But most importantly in rehab and in physio and in treatment is that if you have the locus of control, so if you feel that you're in control of your body, your mind, the pain, then you know how to control things for the long term, really.
How much does that play a big role in someone's recovery, the mental side of it?
Oh, huge. Yeah, huge. You know, like with chronic pain, which is what I sort of specialise in, is like they've lost that control over their pain because pain's deciding what's happening in their life. So if they wake up with pain, they might decide not to do that walk or go to work or go to the gym. And so the pain's already decided their behaviour. Whereas if we can turn that around and go, right, change the mindset, we understand that if we move a bit and that causes relief, then they can then decide to go to work, go to the gym, look after their kids, do day-to-day stuff without harming themselves. So I think the mindset is more about, am I going to damage myself any further? And I think that's the number one question that they come see me for is, can I carry on? And what can and can't I do? I don't want to injure myself further or delay the process.
It's having that voice of reason. I mean, I harp on all the time on this podcast about my injuries. And most of the time I can kind of suss out what's going on. I know where the issues lie. I do see, obviously, professionals when I'm not sure. But the most harrowing aspect of an injury is not knowing whether it is going to cause more pain, whether what you're doing is right. And it's nice to have that voice of reason of someone saying, no, actually, that's okay. If this flares up, it's a positive thing. This is how we get around it. These are some strategies, like you said. So I know I can harp on all day, but you know, you preach into the choir here, because I think physios are worth the weight in gold. I really do. When you find someone who understands it, gets it, and is quite, you know, forceful like you are, I guess, in a way, in terms of getting people back into that functional aspect, it's amazing.
Yeah, thank you. It's difficult because when I do treat the athletes, and they're probably the hardest ones to treat because they are so sort of certain for a diagnosis or certain for what is the structural biological reason for this pain, and it might be one, but there might be other things outside of that. And so when I treat chronic pain, I use a biopsychosocial approach. So it's like the biological side of things, the physical structures, maybe something is injured, damaged, inflamed, torn, sprained. That's the biological side of things. And then there's the psychological side of things, like you said, the mindset. It's like, so what are you thinking about that pain? Like, how do you perceive that issue? Do you feel like you've injured yourself massively, that you need to go to the hospital, you need surgery? Or do you feel like, because of the knowledge and education you've learned through Down2U and speaking to other professionals, like it's that? So then because you've got an explanation, then there's a reason behind it, which calms the nervous system down. So that can influence the healing process. And then there's the social aspect. So like if your mates or a GP or physio goes, you've hurt your back through deadlifts, you should don't deadlift for 6 weeks. And it's like, well, you don't deadlift 6 weeks, you get weaker, and then you lost your confidence to do that. When it comes 6 weeks' time, how do you feel about doing that again? And so you've lost a little confidence, lost a little strength. So obviously it's going to feel a lot harder. And if you haven't done it for long, when you're going to do it hard, when you do it again, it's feeling harder, you feel a bit of pain in your back, you're going to stop because that physio or the GP said don't deadlift. And that might be, weightlifting, but also I see it in loads of runners. They're running, like they've practiced 6 months to a year to do a half marathon. They get an Achilles tendonitis or patellar tendonitis problem. And the physio or the doctor goes, I don't think you can run this event. And it's 6 months or 8 months of training their life to be able to do this event. And because they tried to increase that intensity just before the race, it flared up their inflammation. But it's like, well, what can we do about that? And can we do the event? And most of the times, yes, we can. Because once you've run a few miles in or kilometers in, the inflammation calms down, the pain goes away, and then we'll deal with it afterwards with the strategies that I was shown for that particular condition.
Love that. Cool.
Amazing. You hear a lot of people, don't you, almost go against, not against doctors' orders, but they almost say I almost wanted to do this to prove the doctor's wrong. Yeah. Which, do you find that in people you work with? They come in and they say, I've had this diagnosis and I'm not happy with it. I want to do things a different way.
Yeah, and most of those guys actually find their own way. So, lots of examples for me, let's say 60-year-old runners, they've had advice in their 20s and 30s, gone for scans and showed early onsets of arthritis, and their advice is you shouldn't run because that's going to cause things to be worse. You're going to get a total knee, you're going to need a total knee replacement in the future. Who doesn't? And then they go against it and they carry on running, and they've run up to marathons, ultra marathons, and absolutely fine. They come see me. I've got a bit of knee pain. I'll tell you a history. They told me when I was 20s I shouldn't run. I've carried on running. I feel bad. I feel guilty, and I feel like I shouldn't have done that. And now it's come to haunt me. It's like, well, let's have a look at your training program. What you've been doing. What you've been practicing. Has your intensity increased? What's your nutrition been like? All that kind of other things that might have influenced the pain flare up. Not because you've got arthritis and that's come to haunt you again now in your 60s.
But they've lived the life they want to live, and I think
Exactly.
if that means dealing with a little bit of pain here and there, it's more than worth it. I think for most people, they'd rather do that and deal with the flare-ups occasionally. The issue comes when it gets, as you mentioned, a bit more chronic, and issues arise where they can't run at all without kind of really severe pain. But if it's something you can push through a little bit and manage the pain, I'm all for that for sure.
But I'm going to give you the other side. Obviously, the people that go against the doctor's order and they do run and they do live a life that they've wanted to live passionately, and running was their passion, and they've fulfilled these goals. But then the other alternatives is when the GP goes like that and they go, okay, yeah, I'll listen to that advice. For example, I remember this teacher in his 50s, 55, used to be like a professional climber. He fell off the bouldering, broke his back, and at the time the GP was like, obviously you shouldn't climb anymore because of the risk of falling. So he didn't climb for 35 years, and then I saw him, and then obviously teacher, which is stressful, and his release back then was climbing, and he's never replaced that, because if he falls or anything physical could have flared his back up. So he goes, if I can't climb, that means I can't do A, B, C, D, E, F, G. So then he didn't try anything because he was worried that he's going to pull his back. But then obviously I saw him and gave him all the information, and he went bouldering in the Peak Districts again at some point. Obviously had his crash mat down for the first few times, but then he's back climbing again in his 50s.
You live and learn with these sports as well, don't you? Like once you've fallen once, you're a lot more cautious the next time, let's be honest. He's not doing anything that's too out of his realm, let's be honest. So yeah, I think great advice, and I love that. So just like, go for it, try it. What's the worst that can happen? Don't be stupid. Let's take calculated risks, but let's take some risks that are worth taking to get you kind of doing things that you enjoy, improve your quality of life. And I love that story about how it was his release as well, and exercise for a lot of people is the release. One of the worst moments, as I mentioned before the podcast, was when my back went. The most depressed I've been in recent years is when I couldn't train for like 2 months post that, nothing at all. I was in a lot of issues, a lot of bother, and it was, you realise how much of a response training has to kind of get rid of some of that tension and release from your day-to-day stress.
Yeah, for sure. Yeah. Especially if you train all the time.
100%.
You're used to that dopamine release and the just relaxation afterwards, and that sense of achievement, and like obviously day to day, as you're both dads, that things become a little bit monotone / steady, and it's like with me work as well, because I see these improvements in most of my clients. I also get a thrill, and obviously I'm really happy for them, but because I see it all the time, my dopamine is like, where else is the excitement? And so I'll hit the gym and obviously do PBs myself and challenge myself like I challenge my clients to get that dopamine hit, but also to feel like I've got a sense of achievement in the day, which you might not get in your work.
We need that. I think we're at that age now, as you get kind of post 30, where like there's a reason, like suicide in men is massive as well, because we get to this kind of very mundane way of living where you've hit a certain point in your job, you've got kids now, like a lot of the thrills of your 20s kind of starts to go out the window. You're not going on crazy nights out, you're not getting these big dopamine hits from having nights out with the lads and things, and you've got to replace that with something, and a lot of people don't. They just fall into this trap of being like someone that they don't really want to be, and you need that release, you need that dopamine. And if you've in the mix of that got an injury now that's quite chronic, Jesus Christ, like I can see why people go down quite a dark path, shall we say. So yeah, the importance of training, I think, and the continuation of that is why I think you're so important in people's lives.
So like the most recent case, like I picked up and I saw him this morning, is a postman, and I do some other work which is like workplace assessments. So I go into workplaces, assess their workplace, how is that maybe contributing to the injury or not. And obviously I picked up this guy last week. He's had back pain with sciatica down his left side, and I went in to assess him. That was part of my job. But then outside of that, I'm thinking he needs more, because yes, he'll get back to work on a phase return, 50% working hours, 75% working hours, 100%, gradually increase again. Yeah, he'll successfully increase. But in the last year, he's had 4 episodes. So he's been off work 4 times for this back issue. So I said, I'm going to be honest with you, you're probably going to head down that route again. You're going to get a phase return, and then you're going to work for a few months, and then your back's going to go again. Because you've not learned how to move efficiently, release the tension from being a postman, which means you're walking in with one post bag on one side for 4 hours. Obviously, you're sorting, moving parcels, bending and twisting repetitively, which is safe, but because he's done it for now 36 years, it's just caught up on him. And in most recent years, he's lost his confidence to hit the gym. So in the last 18 months, he's not hitting the gym. With reducing that, his episodes have increased. And so now he's in this cycle of, do I lift? Because my job is physical, and if I have one more absence, then I'm going to be on stage 3, which means I'm at risk of being made redundant or fired. Or do I just protect my back, rest it, and then just try to crack on with work? And so he's in that fine line. So I rightly or wrongly, I said I do own a clinic in Kellam Island, so come and see me. Came to see me today. Previous treatment he had was 5 chiropractic treatment. Actually, he's had chiropractic treatment for the last 10 years, and there's nothing wrong with chiropractic treatment, and it did help him return to work at most times. But he said today, I wasn't learning anything from my back. Like, I'll get better, but then I'll go back to work and I'll have another episode. And he started to recognise this pattern. So I said, let's teach you these techniques, and he already got loads out of it. And the next session, no doubt, I'll be deadlifting with him. And he wants his goal was to get back into the gym and have the confidence to move his body as a 59-year-old with grandkids. So so we'll see where he goes. I'm sure I'll post it on Instagram.
Look forward to seeing that.
That sounds like a massive motivator as well, getting back in with his grandkids. And I mean, you've shared quite a lot of success stories already that you work with. I suppose one of my key questions is why do you do what you do?
Because I suffered with chronic pain when I was a young kid. So when I was 17, I had the traditional cool one strap bag to one side, the parcel bag. My parents are Chinese, obviously, and they want the best out of me. So they said, right, 6th form, go to this school, Silverdale, which is 1 hour away from me. So I had to carry the bag, walk down to the tram stop, which is like half an hour, get the tram, get the bus, and then walk another 20 minutes to get to school. So at school, before that, I was obviously going to school, caught a bus, and then got there and then back. Not much walking involved. Also started playing football around that time, so I was a late bloomer in football. And I just started getting left-sided lower back pain. And I remember my mum saying, let's go see a physio. Well, I went to the doctors first, and then we went to go see a physio, and then we ended up seeing a private physio. And he gave us some basic stretches, which I give still now as a physio. And it helped somewhat. And then as the life of stress came in, exams, more walking, went to university, lived on my own, played more football, all the stress was just going on my left side. And I just woke up with pain every day where I just wasn't having a good time with my life. So first thing I would wake up and I'd be like, there's pain in my back. Got to go to university. Still wore the bag because I thought it was cool. Didn't know that was a contributing factor. Obviously played football, so I'm right-footed. So left foot is planted on the ground every time. So all the tension was going on my left side. Played football. Didn't qualify as I didn't get into physiotherapy straight away. So I did a sports science physiology degree for 3 years, and then that just fueled my passion to become a physio. Then I did a master's for 2 years as a physio. And then as I qualified, and during that university degree, even in sports science, I was like asking people, why do you think I've got this back pain in my left side, in my lower back? The pain got so bad it was spreading up into my left shoulder blade as well. And so the shoulder blade had this constant nagging, I call it nagging pain. It's just constantly nagging and dulling on me every day. So, you know, I woke up and I was already like 50% charged, because I had pain to deal with on a daily basis. And so then, as I was asking around, asking loads of opinions, and I was getting temporary relief through soft tissue massage, deep pressure, some stretching, acupuncture. But after a few days, the pain would just come back with a vengeance. And I was like, why is this happening? Because it feels great at the start and then just comes back. And as I just did some more searching and more questioning, I learned my way, which I teach people, which is we can't quickly release the pain. It's a bit like somebody losing weight. If you lose the weight quickly, the weight comes back quickly. And that's what happened to me. The pain went away very quickly through the deep tissue massage and the pounding and feeling bruised. Oh yes, there's a different sensation to my pain. My pain just came back with a vengeance. So I wasn't learning anything. And my body wasn't learning anything. So through now, how I teach it, and when I say to you, like the most important thing I teach every client I see on the first session is how to release the pain. And the word is release. Not only just the physical pain, but your mental and emotional, because the technique is used for both. It's intertwined. Because you can't relax your body without relaxing your mind. And so through releasing it in a gradual way, in a slow way, taking that breath, being with your body, understanding that, and the pain then subsiding, magic moment, the pain goes away. And then because it's a slow release and you are actually teaching your body to switch off, your body then stays calm for longer and the pain signals are switched off for longer. And so once I learned that technique, I was like, everybody needs to know this technique. And so I did the muscle release techniques, but then it always comes down to the spine, in my opinion. Where is the spine stiff? Where is it not moving? Because what happens is that the muscle will kick in to look after the spine where it's not working well. So when you prod down the spine and you go, what's that feel like? Pressure. What's that feel like? Sharp pain, bruise. Okay, that's the one that's not moving very well. Let's get that one moving. That one moves. Once your spine starts moving, the muscle can relax. But what a lot of people do is look for the symptom relief, get rid of the pain. So you're treating the muscle, you're pounding it, getting massage, cupping, acupuncture on the muscle. Painkillers, heat, cold, all the good stuff. Even surgery sometimes. But the underlying issue was something just next to it, which everybody's missed. And that's why the hands-on approach is super important, in my opinion. Which, again, because there's a huge social media debate about, should we do hands-on technique as a physio or should we not do manual therapy? What's the benefit? And for me, it's like, I'll do the manual therapy.
Just for us kind of guys who are not really sure what those two are, what is the difference between the hands-on and the manual?
So when you said hands-on before, you described the hands-on, getting them squatting, getting them deadlifting, yeah, and that's exercise prescription, and yes, we're there and we're being hands-on kind of thing. Okay. Hands-on, literally physically putting your hands on somebody. Yeah. So like using your hands to make a change on the body. So that could be massage, it could be joint mobilizations, it could be chiropractic cracking. Okay. So there's a debate whether we should lay our hands on patients. And as you can see in the NHS now, they've took that other stage, which is maybe they're less hands-on. Because one, it takes time, and two, we're living in a world where we're moving towards America, where there's a lot of suing going on. So if you do lay your hands on, and there is a change, and there is a provocation of pain or aggravation of pain, you did that, you made that worse. And then so that's why...
It's a shame that, isn't it, how it's come to that, where, you know, sometimes sport massage, I've found in the past, can be really helpful. I see a guy... regular when things I get a bit of a flare up, and it's amazing how it just resets it. I don't think my pain's anywhere as bad as other people's, but it is a bit of a lifeline for me. But it's a shame that certain industries, like, you know, the NHS for example, aren't doing as much of that, which people might need because of these, you know, potential suings.
So yeah, and I use it as a buy-in. So I go, this is the point that you need to be familiar with. I'm going to find it for you now. And then I'm going to show you how to recreate that release yourself. And that's why...
So are you technically a bit more hands-off than are you in terms of your approach?
So when I do the hands-on initially, and then I show them the techniques, they should be able to really simulate the treatment I'm giving them. But if they do need that extra bit, for example, post-race, pre-race, pre-event, post-event, or they just feel like, I can't get to that bit. I know you've shown me the technique. I've tried my best, and I'll review their techniques endlessly to make sure it's spotless. And they still can't find the bit. then I'll use my hands there.
Okay.
But it is down to you. So I'll be like, right, you know the methodology, you know the treatments, and you know the strength work, you know the release work, but it's down to you whether you want to come see me for additional work, extra advice, technique, improvements. It's all down to them. If they want to just do it by themselves, it's down to them that way as well. Hence why it's the down to you approach.
I was just going to ask that, like, where does the name come from? But as I heard you use it in a sentence, then I'm like, that makes complete sense. That I'll show you what to do, but then it's literally down to you. You have to replicate this, and I think more people need to hear that message. And I think if there anyone, when I first told people, like, contacts of mine, that listen, we've got Adam coming on, he works with like chronic pain. Have you got any questions? The amount of people who are like, what can I do for my back? What can I do for this? And it's amazing how many people just, they suffer with that. And I don't know if you get this, Ryan, in consultations, but I say, like, are you in any pain? And they go, no, just normal pain. Yeah. I'm like, what's that mean? What do you mean you're in normal pain? The normal pain should be 0. Like, so do you find that a lot as well?
Oh, exactly. Like you said, like Ryan saying, like, I've got this ongoing pain because you train, and this is because I work in CrossFit. It's kind of the norm that, oh yeah, there's a bit of niggles in there, but my philosophy, like you just said, there shouldn't be any pain there. Yes, there should be some post exercise pain, your aches and your DOMs, but you shouldn't have like that lingering pain that just stays in the background. That's like ongoing weakness, and it's about exploring why is that there, what is that supporting, what is that stabilizing, and if we make that thing stronger, then that can switch off. It's a huge one.
I like how you mentioned like a variety of jobs there as well, like a postie, for example. I think a lot of people who probably don't get a lot of attention maybe on social media or in the mainstream are maybe people who have manual jobs. Like I was speaking to my father-in-law last night about having you on, and he's suffers with his back a little bit. He's a kitchen fitter. He's very hands-on and mobile, but he's still struggling with his back pain. And trying to really get to the root of it, I feel like a lot can be made of people spending a lot of time sat down, being sedentary. Do you find that split between the two types of people you see? Are they either sedentary or active jobs?
Yeah, so I'm not sure if you've allocated time for my program in a bit, but the program is designed to help people that have sedentary jobs, but also very manual jobs. Because in the end, pain is pain for me, and that why is it there? And it's usually a build-up of tension. So you could be a kitchen fitter, but you could be sat down all day. It's like, but what's your tension levels like? Not just physical tension, because obviously there's a physical demand to it, but what's your mental tension like, social and emotional tension like? Because that all adds to the pain. So there's a definition I use in my program. I can't remember exactly, but it's pain is it's a sensory and emotional response to a natural or potential stimulus. And what I love about that definition was in 1979, and I've kept it like that on purpose, because in 50 to 60 years ago, they already recognised that there's an emotional response to pain, and there's also a potential aspect to pain. So if you perceive that something's going to be painful, it's most likely going to be painful, right? Like going on a roller coaster, that adrenaline, that's not fake, that's real. And the anxiety about going on a roller coaster is very real. And then you go on it and then you're fine. But, anxiety is very real and pain is very real. It's not in your head, but it's how you perceive about that pain, what you think about it, the psychological aspect. Yeah. If
someone's maybe struggling then, I don't know if you were going to go down this line of question as well, Ryan.
No, I was just going to say how good that analogy was, the roller coaster analogy, because you're absolutely right. Like, some people are thrill seekers, and some people would never ever dare step foot on a roller coaster. It's the fear, isn't it? Some people crave that fear; they want it. They'll go looking for it in life, and some people avoid it. And I think pain is exactly the same. Like, some people, they're not looking for it, but they know how to manage it. They're very good at like dealing with it, coping with it, getting past it quickly. And then other people, it's just not something their body's used to, or mentally or physically used to kind of coping with. And I think that I like that analogy, the roller coaster one.
The other analogy that I use for the pain, especially people with chronic pain, is the red line, working to the red line zone. So obviously people that have conditioned regularly, that go to the gym, they'll regularly take themselves to the red line. Whereas when you're in chronic pain, because the sensitivity of the pain increases, your tolerance to the pain line is lower. So you might do just a walk, half an hour walk, and you get the pain. Whereas somebody that goes to the gym all the time, or hits the deadlifts, go walking all the time, running, their pain line might be a half marathon before they hit the pain line. And so it's about how do we shift that line to higher. to increase that tolerance. And through doing the deadlifts, heavy or squat or running or whatever I do with my clients, it's about shifting that red line closer to that tissue tolerance.
Tissue tolerance. I like that. I like that.
Hence why you want to get them doing 85, 100 kg deadlifts, so that all that 30 kg stuff is a breeze, basically.
Yeah. So you're giving them more capacity
Amazing.
to do that. Because my job is to get them back to work. So legally, the heaviest lift as a single person is 25 kilograms. But as you said, you was picking those granite patios that you were gardening at 80, because you know that you can deadlift or hold 200 maybe. Yeah. So you know where you are, whereas a lot of my clients don't know where they are. So they're like, I want to get better, but what does better mean? Like pain free? Okay, but pain may fluctuate. One day you might feel pain very much, one pain you might not feel very good. So it's like you're judging it on this subjective feeling, whereas I judge it on tangible measures. Like, so what you're deadlifting today? 60. Your back's not good today, so I'm doing 50. Okay, fine. So you're 10 kilograms less.
Cool. Yeah, really like that.
I like that. I probably wanted to debunk a bit of an expression now, a really common one in the mainstream, which is no pain, no gain.
Yeah.
Which I imagine, judging by your face, that you're like, I've just had enough of that. Like, what are your thoughts on that expression? Because I know it's quite prominent in gyms and like social media culture, where it's like, no, you've got to go through the pain to get the gain. But should that word maybe be replaced?
Oof. I do like the cliche, to be fair, in certain sense of training. So my training, when I'm releasing tension or releasing pain, we are not using that motto. We are find the pain and release it. Whereas when, and this is very important when in my rehab, is that yes, it's very important to be relaxed and like free spirited, happy, hippie, switch off, but also you need to have the ability to switch on. So forever, whatever work you've got, maybe a kitchen fitter, warehouse worker, postman, you've got to you have the ability to hold tension too. And so yes, we need to go, you can release, the pain's come down, but now we need to go and increase that tension. And sometimes we use no pain, no gain to work that red line, to push that red line towards that tissue tolerance. But then do you know how to switch off? Okay, you've gone to the red line, now do you know how to switch off? And that's the important thing about my methodology, is like, okay, we've done the release 1, 2, 3 sessions, let's go and deadlift heavy. Oh, you've just pulled your back during the thing, see if you can release it yourself. And I'll supervise. I won't lay my hands on straight away. I'll be like, can you do it yourself? Yes, I can. Brilliant. It's gone off. Let's go. And that's how you would live your life. You go to work, posty, 8 hours a day, walk 4 hours, release tension afterwards. Great, that's the habit. Rather than reaching for the medication or hot water bottle, which again feels nice, but you're not releasing that physical tension that you've built throughout the day.
4 years ago, when I was in serious chronic pain, I needed this message. I really did. If I'd have listened to something and listened to your sort of methodology and the way of thinking, I'm really hoping that someone who's listening to this with chronic pain, whether it be back pain like me or whether it's shoulder pain, neck pain, whatever, that they actually pay attention to what you've just said about the social side, the emotional side, and just how to switch off and I suppose not de-trigger. What's the correct phrase for that? But almost get sort out yourself, essentially de-stress. Yeah.
I think that it's also great that you're giving people that lifeline as well, and reiterating that message of it doesn't have to be like this, and it isn't normal, that kind of pain. There's ways around it, because I think a lot of people do just fall into that mindset of like, this is just me now. Like this is just normal. Like I have to learn to not do the things I love to be able to kind of just get by day to day. And I'm sure a lot of the people that come to you always say, I wish I'd come here 6 months ago, I wish I'd come here a year ago, I wish I found you more recently.
Yeah, the guy who's doing the chiro is like, I'm not going chiro anymore, and again, no offense to chiro, but he's like, I wish I knew this before, I wish I knew it when I was younger. I was like, but you're 59, you've still got 30 odd years left, you know, you can still change your destiny there. Again, another example is like pain gets us at any age. We've all experienced pain at a very young age, but we always assume like pain, arthritis gets us in our 50s, 60s. But pain gets us any time. And I think athletes who have obviously been kids that have been training for long periods of time, they're again more vulnerable to pain because of the tension of using their body repetitively, but not getting the active recovery or the right recovery. So a guy that come see me, he's young looking, he's just turned 30, and he's a polisher in a warehouse. So he just literally polishes things. He's leant over a table, head down, polishing. He came and told me about his symptoms being on one side, and it triggered my pain off. Because psychosomatic, that is also true. There's a thing called neurotags. I'll tell you more about that.
Wow, so he came to you with an issue, and it made your issue flare up.
Yeah, because his symptoms were the same as my symptoms.
I've experienced this before,
Wow,
but I've never heard it. And what would you call it? You say it was
Neurotag.
Neurotag. Yeah.
That's fascinating.
And actually, like injuries, and this has happened many times in my career, is that the same symptom or the same condition will come like buses. They'll come all at the same time. So I had 4 or 5 clients with the same of my issue come see me, and that triggered my pain off. And I told them, like, you've triggered my pain off. And I said to them, like, foresight, saying that you will probably trigger my pain off, and it did. And so I did my own rehab and got myself back now. And actually only after last week when I did the half marathon, that's really just reset my body and my mindset, because I've not really been training. It's been a busy year with a 3rd addition to the family in terms of the kid.
Congratulations.
Yeah, thanks. 5th edition, sorry. 3rd kid. So it's interesting how the psychological and the social aspect can influence your pain, going back to neurotags, which again I'll tell you about in a minute. But this guy, he was just over his desk, and I said to him, like, because he only had a limited amount of funds, he didn't get a high paid wage, I said, within 4 sessions you know what to do. And second session we deadlifted, and he did 120 kilograms, he weighed 70 odd kilos, and we did box jumps at the end. So there's the strength element, but then the dynamic element, because he likes to ride bikes off track. Cool. On dirts, so he needs to have that impact and be able to take the impact through his back, but also the dynamic ability to move and swerve. So we did box jumps in the gym, and he did 8 mats, which is almost same as me. My PB is 8 mats, which I only figure out because a client challenged me after seeing my videos.
Oh, really?
Because again, in life we don't get challenged. Like, when do we do our vertical jumps? When do we do a 100-meter run? When do we do a deadlift max? When do we do a squat max? And especially at 60 years old. Last week I had a 64-year-old who maxed on his deadlift, never deadlifted in his life, does body pump and stuff. And he body pumps at 30 kilogram deadlift weight, and then he did 120 at 64. So I said, well, what percentage are you working at? Less than 30%. Yeah. So could we push that percentage?
Yeah. It's about what you're exposed to from a training perspective, and no one in a body pump class is ever going to get you to do more than, mainly the weights they've got available, but what they feel comfortable doing, what they feel safe doing. I had a similar issue, or not issue, but a similar situation arise of a day where I had a client who I was coaching for a fire service test, and part of the test is to be able to get 9.2 or 9.3, is it, on the bleep test? And he called me out basically and said, I want you to do it with me. You've been doing all these runs, like, show me how fit you are. I was like, shit. I'm going for the bleep test now. Yeah. And it's funny because I hadn't done the bleep test since I was like, God, like in the teenage years, during football practice and trials and stuff like that. And I got those same nerves, it's weird. I brought back those same, as I was laying the kind of like cones up and I was setting my little speaker, I was like, God, I feel a bit nervous there. And you hear that beep, beep, do, level 2. And I've had all these weird like flashbacks, and but yeah, it was great to be challenged and be pushed, and to actually kind of have the shoe under the foot where the client says, what are you capable of?
How did you do?
I don't know, what did I get? 12 something, I think. Nice. Yeah, it wasn't too bad. I was pretty happy with it.
That's firearms standard.
Yeah, is it really?
Firearms police? I used to work for the police as a physiotherapist, and so their standard yearly beep test is 5.4.
The police, I know that because I've got a police officer that I coach as well, and he's always gobsmacked at like how low it is.
Yeah, but then challenging for a lot of them as well. So I saw a lot of clients who struggled, and I literally had to take them out to the back of the unit, and this is where it all began, the functional side of things. Well, it began before that, but we went to the back and we literally set up cones and we'll practice at the back. Because yes, I can tell them to practice at home. But first, would they practice it because of time, and 2, the confidence. So I'll be like, let's just do it now, we've got time. So we did it, and that felt alright, that. And I'll give them little cues, so rather than turn off one leg at each end, turn off right leg there, left leg there, because it could be a knee issue. So rather than just going off your dominant side and like causing stress and tension on one side only, make a conscious effort that you're swapping legs on each side.
It's funny actually, I did exactly the same thing during the glute test because I found that I was always pushing off on my right leg.
Yeah.
And so I started pushing off on my left leg, and it's amazing what difference that made as well. I had a bit more drive because that right leg was getting fatigued on the push off. So when it got past 10, because I pushed off my right leg so much, it was now fatiguing like it would do, doing a walking lunge or something like that. It's like walking lunging, but just with your right side.
Exactly.
As soon as you start using your left side, I've got loads more power, I can keep going here. It was amazing as soon as I got that left side involved. But again, just technique as well, isn't it, with stuff like that?
And how can you see that without seeing it? Like with my clients, that's why I go, let's go deadlift. Let's see what you're lifting, how you're hinging, where you're moving from. And obviously the biggest myth that we need to bust is, can we flex with the back when we deadlift? And that's a big one, obviously, in our industry. Is like, ooh, that's bad. I had a guy that works for me. He did really well on a powerlifting comp this weekend. He came first. He got some crazy numbers: 260 on his deadlift, 260 on his deadlift, 240 on his squat, 180 on his bench. And then he posted something of a female doing a 200 kilogram deadlift. And then she got comments, that lift is terrible, feel sorry for your lower back in the future, how have you got this far? And it's like, well, obviously she's like almost professional and she's lifting with a flex back, and you'll see Eddie Hall do it, and he's a heavier lift as well. And it's debusting that myth that you can't flex in your back, it's going to cause you injuries. How do we know until we do it?
Would you say people who maybe want to start lifting with a little bit more of a flex back in the future, or progress up to it, going from perfect posture to maybe flex back straight away, is that inadvisable, or are we thinking like progress up, gradually build up with it?
It's crazy because I can't remember where I heard it from recently, where they said that their weakness was when they got to a heavier lift, they started flexing their back, so they started training with flex back to build that tolerance, have that flexion in the back and that awareness that that's happening. Because how many times, I was at a ceiling of 160 deadlifts for 5 years, and then I learned that you can flex your back through a social media guru who's got a lot of followers, a physiotherapist. Safe to flex your back. Okay, so I put it into practice. Scary as hell. And I started flexing my back, and I was like, oh. And then I started passing that ceiling, got to 180, and I'm on 180 at the minute. I've not challenged it since. But that was a game changer, because as you go heavy, your back will tend to flex. And so if you give up on that first flex, then you're never going to pass that ceiling, which I found myself in. And hence me living through that experience, I'm able to tell my clients, like, you're getting heavier now, your back's flexing. When you feel that flex, you're letting go of the weight, because I can see you doing it. And then you're in your head. So I was like, right, give them that advice, it's okay to flex your back. And that's why we do pelvic thrust and get into that really strong plank. So let's work with that. And then they pass that and they do another couple of lifts after that. So your question about should we start flexing the back from the beginning, why not? Why not?
Yeah. No, I totally agree with that. It all comes down to the brace, and that's something you've mentioned a few times on the podcast already. It's like getting clients to do things with a certain technique and brace. The issues with the deadlift, I think, come when you start straight and then you start going round. Either go fully committed to straight or go fully committed to the flex. If you start doing a little bit of both, which is actually what did my back, because I'm pretty much more of a straight backed deadlifter. But because I couldn't keep it straight, because I've been shifting these flagstones for a week, it started straight, couldn't maintain it, went rounded, and that's when the issues arise.
Yes, exactly.
So I think that it's committing to one or the other. Are you going to be straight? Are you going to be... I mean, you look at some Olympic lifters. Olympic lifters will never flex, but the reason they don't flex really is because they have to catch the bar, don't they? They're lifting it past the deadlift. They're being a lot more explosive. Yeah. They're holding it, standing it in a completely different way to what a competitive powerlifter might do, which is generally sumo stance now, isn't it? Most of the time. But it's knowing where your preferences lie, I think, with a deadlift generally.
Yeah, it's difficult, and I think, like you say, you're going black and white there, and I feel like in my treatment it's like a nuance, like you can flex, you can thing, and especially with life, like you say, if you're doing 80 kilogram patios, not just a one time, but lots of time, it's impossible because of the shape of the granite stone to stay in a straight back, and there's going to be some rounding there. Yeah. So if let's say you deadlifted and you were used to rounding your back, would you have pulled your back?
No, do you know what? You're absolutely right. Yeah, I guarantee when I was shifting, for context, by the way, we're talking about my patio in the back garden. Me and Adam were having a little chat about like when my back went. So I spent a week relaying some patio in the back garden, and these patio flagstones, like you said, were 80 kilos. There's no way I was picking every single one of those up with a really good, perfect technique like I would do with my deadlifts. Perfect in quotation marks, by the way. But so I was doing something that was irregular for my back, but also as well, how many times do people lift something off the floor and then actually start to twist side to side? You would never do that with a bar, would you? You would never pick it up and then turn it to the side and then put it back down again. It just goes up straight, it comes down, but it's a very linear movement. And I think that's what, if you refer back to kind of your postman, a lot of his lifts will probably very much like that. In the gym, you can probably go quite heavy, you can probably lift, but if you start even lifting a third, a quarter, an eighth of the weight, but then start moving that extra little twist in there, it's just challenging the spine and the muscles in the back in a slightly different way. And that's something that is you have to train for. Like, you have to be doing certain exercises. And when I saw my physio, he was straight away, right, let's do some pal off press, let's do some things that are going to rotate your spine and get you used to moving. So it's about having your eyes open. I think there's sometimes different ways of doing things and areas of weakness in your body.
But like you say, if you look at the gym, I always say to clients, like, that in life as well, you're just challenged in this unilateral position, which is straight on. So when you're on a cross trainer, when you're on a bike, when you're on a treadmill, squatting, deadlifting, bicep curling, bench press, all straight ahead. They say until you do the lateral movements, until someone challenges you, shows you that thing. Why is it important? That's why it's important. Because in life we need to twist as well.
Yeah, we do.
And side bend and lean and stuff like that. And hence why the guy that rides bikes off road, so we had to do some unilateral stuff within it too. There's actually not a lot of equipment that's in the gym that promotes that. Cables.
Oh yeah, cables of course. Yeah, cables. For sure. But if you went aside from the cables, no piece of equipment really, everything's super linear, isn't it? And actually, when you see people even use the cable machine, most of the time it's a bicep curl to push down. Like that rolls, not a lot of people actually doing your lateral twists.
Sandbags are good. Sandbags are decent. I think
the most common thing that people might do from a twisting point of view is maybe like a Russian twist or something. You know what I mean? That's one that most people generally tend to throw in for core. But aside from that, I very rarely see people doing your pal off press and things of that nature.
I think that's what I really like, because your approach isn't black and white. Like, it's very much in the grey area. I'd say your approach is probably more like a philosophy, isn't it? Where it's like there's that many nuances to it that it's like, if you are this way, you could go down this pathway or this pathway or this pathway. So it's always worth, like, if anyone is curious, like, to obviously speak to you and like ask you the questions and come and see you. Which I just want to sort of pick up on something you said earlier about the latest addition to the family as well. So how do you find managing? Have you noticed any flare-ups from having kids, especially having the extra stress of 3 now as well?
I guess though. So when these clients came in, these 4 clients that flared my pain up, my latest son was born at the same time. So there is that element to it. I cannot say, for example, for definite that there was no contributing factor. Of course it's going to be contributing to me somewhat. The thing that I heard that still I use is that the body holds the score. So like men typically, we're very good at dealing with stress, holding it, and then it comes out in a physical sense. So for me, my pain got flared up, obviously, headaches, and low back pain. So it's like, what is my body holding on to at a minute? And it's recognizing that. And I feel like I'm good at recognizing that myself, hence why it's down to you. Has it flared it up? Yeah, my pain got flared up. So was it to do with the new addition? Was it to do with the 4 or 5 new patients that had the same pain as me? Who knows what flared my pain up. And obviously my training's been a bit up and down as well. So the inconsistency. And that's what I mean by the grey areas. Like, you come see me and you've got a diagnosis of spondylolisthesis. And you go, my pain's bad now, but why now? Like, your physical issue was there for 10 years, but why is your symptom bad now? And I'll explore like what else is happening in their life. And that's why I said to you at the start of the podcast, I don't know if I'm physio anymore, because I am delving into people's lives in that sense too, and figuring out and talking to them, and they're very happy to speak to me about it. And they go, didn't realise that was there. And a lot of my clients do cry in sessions, and they just feel this massive relief because they have nowhere else to dump it. you know, because their friends see them as a strong person, or just not the space to be able to express that emotional side.
How would you describe your own professional capacity now? If you had to give yourself almost like a job title, because I feel like people do this sometimes. They make up their own job titles, and I'm like, I feel like you deserve to make up your own job title because of what you do.
Yeah, it's so difficult, mate, and because in the chronic pain realm now, there's a lot of health coaching in NHS. NHS, they like hire health coaches because they have more time, so they have half an hour to an hour to speak to clients, talk about different aspects of their lives, like what's stressing them out, what about work, diet, pain, and they help them sort of signpost different areas of professionals. So, you know, I guess it's a coach, but like, that's just the general sense. It's just coach them in any part of their life. It's interesting. Yeah, we
love having coaches on, don't we? I'll be honest.
Absolutely, of course. Yeah. People just like, you know, do what we do and can have a good chinwag about it. But I think I would say, are more in the realm of physio, from a kind of what people would recognise you as.
Yeah.
I mean, it's in the name, isn't it? Down2U Physiotherapy, I guess.
I've actually changed my name recently to Down2U Health and Wellbeing.
Have you really? Okay, cool. Do you think you're moving away that much from like the strict physiotherapy practice that you?
So as we mentioned, like, you know, I do run a program called the Work and Pain Solutions Down2U, which is working in collaboration with the council. So I get funding from the council to help people who are unemployed and economically inactive get back to a life that they want to live. And that might be work, but that might be just social interaction and reintegration again, maybe hitting the gym again, playing with the kids again, whatever it is just to make that positive change. And with that, I'm finding that, yes, through physio and through the advice and through the education, they get to a point, and then I want to help them more, and then I'm signposting them to different employability services to improve their ability to find a job. So I'm finding that if I can help them that one more step, then hopefully then they can start to work, then fund a physical activity, maybe join CrossFit, maybe join a gym, and so it's that step I'm missing, and I am working towards that as well. Yeah.
Cool.
Yeah.
Amazing. And I think CrossFit Kum in particular, where you work out of. Yeah. We spoke about some of the coaches there individually, like you know, Ollie, James, Dan, Phil, who's there. Like, they're all incredibly good coaches, and they speak so highly of you in particular in terms of your approach and how you do things and how you're always doing that. Like, you're trying to leave things better, I suppose, than what you found it. And it's not just, right, that's my program done, bye. You know, it's very much like, right, what's next? What's next for you? What do you need help with? Which is amazing, mate. And look, I'm really proud of you. Like, I've known you for a long time. When I first met you at Firehouse Fitness, I think the key thing for me were probably, I suppose, how engaging you were. Like, you could tell you were really interested in what people were saying, and from a coach's perspective, it comes across really well, and it is engaging. It's hard to fake that as well. So you're a real man.
And before that, it was the IS actually, mate.
Oh, was it? Yes, it was. Oh, man.
Long time ago.
Yeah, it was.
Yeah. And Joe Patterson was there.
Yeah.
We're all like young kids there trying to train.
Oh, man, I feel like a terrible friend now. Actually,
got a few years off the other friendship.
I did, I remember now. Yeah, you've just given me flashbacks now, mate. That one of them, what do you call it, neurotag?
But I think that you know, just hearing your story today, I think there's no one better to coach this stuff than someone who's been through it. I really think that you having that chronic pain, as horrible and as tough and as, you know, difficult as it can be still to this day, when you get your flare-ups, you understand the patient and the client more than what a lot of people would if they hadn't had those issues. And there's two camps of pain, isn't there? There is the kind of like the man up, just get on with it, do what you need to do. And then there's the camp of like being very empathetic, and maybe sometimes too empathetic, I think, as well. Like, you can go down that route where some people aren't forceful enough. They're too sympathetic to pain. They're like, no, you have time off, do what you need to do. And I think you bridge that nice gap between having done both, where you've, you know, probably taken a lot of time off, had to kind of restrict things in your life, but you've found a way of making it work, and you understand that path and those steps that need to be taken to get to that point where you're relatively, most of the time, pain-free. And that moment you said when you were like, I found it, I knew what worked, I cured it almost, and I wanted everyone to know that. That was, you know, really nice for you to say that, because I think you've got a why behind your message now. You've got a really powerful reason to spread that on. I want everyone who's in pain to know that there's a way out and it's possible, and I want everyone to feel that.
Yeah, but also not to let it restrict your life. Like as Brad said, I'm fairly strong, but you're still living your life to that capacity, so that you can pain free or managing your pain, but you're able to still achieve your goals, achieve your dreams, challenge your body in that way. Because again, the beautiful thing about social media is that you do see these examples, and that's what I'm trying to do on my media page. Is like, yes, you have a stroke, but what can you still do? Like, you're 44, you've had a stroke, unfortunately. Let's go. Let's see where you're at.
I think people see themselves like it's this car where the car blows a gasket and like the car can't move anymore. It's parked up on the drive. It's like, well, what can the car still do? Can you push the car down the road? You probably can if you tried. If you tried to like change a few little bits, could that gasket work? Yeah, it probably could. It might not work the same, but it can still work. And I think people see themselves as this like a write-off. They just write themselves off because of one thing, and there's still things you can do. And that's where the enjoyment, the passion, and hopefully down the line that pain management comes from as well.
Yeah, and the reason why I'm smiling is because I do use my treatment philosophy as like a car garage sometimes, and it's like I go to a proper dealership and you go, you need to change your brake pads now, and it's going to cost you X amount. And then I go to a local dealership and goes, you still got 1,000 miles, come back 1,000 miles later. I'm like, I'd rather have that approach, and I trust you because you're telling me that I don't need to change right now, I can do another 1,000 miles and come back. And that's my same approach. Is like, yes, you've got a bad back, but what can you do with that bad back? What's your function like? Yes, your pain signals might be telling you stop, but does it actually mean stop? Or does it mean that you're stiff, or you're weak, or you're not managing your tension well, or your endurance for that activity is not very well? So that's the concept of my program, is on those 4 things. And if you get control of those 4 things, you start to get that locus of control, and then realize what's causing you the pain.
Interesting. I feel like I need to jump on this car analogy now. I suppose my thought was, imagine you've got someone who's got like a really good looking car, like new tyres, waxing it all the time, but their engine's absolutely blown. Like they're just neglecting it, like it's clunking every time you drive it. I suppose a lot of people might train that way, where maybe they look great, but they might feel terrible. And I suppose I wanted to challenge you really now, mate, to talk to that person directly. You don't have to look at the camera directly. But if there is someone maybe who's listening who maybe is in that situation where maybe they look all right, or they train for aesthetics, but they feel horrendous, like they've got awful pain, they don't know what to do with it, what would you advise to that person?
I see those at CrossFit, because obviously, yes, they're good athletes, but a lot of people like us, we use it as an escape for stress and for things. So they realise that it gives you that relief, but they're challenging themselves so much, and that tension is so full that they get in pain afterwards, and they're like, oh, is it worth it? And then they're knackered and their energy's low, and then you're like, no, we're going to hit again, because that's what they say, social media, exercise is good, movement is medicine, all that stuff. So it's about, okay, that's great, and I encourage you to carry on doing that, but make sure you're doing the other side of things as well. So what is truly relaxing and what's truly releasing your tension? So icing, hot baths, those kind of things help. Meditation, mindfulness, breathing, releases, stretching, those kind of things. So you got a bit of balance between the two. You don't have to be like balanced like a weighing scale, but at least you've got some sort of release that way. So you're not just using your body full on. For example, the poster, yes, he's postman, tension, and then hits the gym, tension. Where's your release? And we usually rely on sleep, good sleep, eat, which is fine, but then what else can we do on top? And the stuff I give is very practical, very quick, that you can do in the day. So it's about realising, are you just burning both candles at both ends, or can we just slow down one bit, realise what's actually going to re-energise you, and then back on that. Don't forget that side. That side is definitely encouraged, but it's also, how do I reset? Yeah.
And that reset is like, I think, the thankless task, isn't it? It's the one that you're not going to wake up after a week of stretching and have bigger biceps or be able to deadlift more or squat more. A lot of the time these things are just like getting a regular service. That's kind of, I can't get off the car analogies. So you're servicing your body, and it is a thankless task, because a lot of time, if you're doing your job right with your rehabbing stuff and your pain management, you won't really have any issues. But it's not, a lot of people, what they'll do is they won't stretch and they won't look after themselves, they won't ice bath or sauna or do the recovery elements until things go tits up. And that's the big issue. I think it's having as part of your routine, as much as you are, if you've got someone who's coming to you and they need to really change their life from like a weight loss, fat loss, muscle growth perspective, there's bigger fish to fry there. in terms of getting the habit sorted and what they need to do on a weekly and daily basis. But eventually, you need to start having a habit and a routine for your recovery, I think, as part of your kind of at least weekly routine.
Yeah. So when I do give exercise prescription or my treatment, it's like, it's down to you how you want to do this. I'm not going to give you reps. I'm not going to give you frequency. You fit it into your life. So figure out, is it better to do it before performance? Does your performance improve? Oh, it does actually. Do I need it for that day? For example, I'm training for half marathon. I'll do the release, do the half marathon, feel great. Do you need to do it after? No, I feel actually okay because I've got the adrenaline, my body's warm, etc., etc. Or are you just doing a fitness class? Do your fitness class, release after.
That's interesting. So you don't really give any advice on like when's the best time to do it, because it's so different person to person based on like the exercises and activities that they're doing.
Yeah, work life, everything like that. Because the principle is the same. The principle stays the same, which is release at some point in your life. Learn to release, and if you know how to release, that's the biggest thing I teach. And that's why it's down to you, because also I kick clients out. I don't keep them on. So I'm like, 4 or 5 sessions, I've taught you everything. You should be on a road of understanding what's your problem and also how to do things. Do you feel like you're there? Yeah, I do. Great. Off you go. Come back, see me when you need to. And it's not the best business idea and the best business approach on paper, but that's how I work, and that's how I've always worked.
Yeah. Without kind of spilling all the beans and secrets.
Asking for a friend.
You know, what are then the step-by-step processes you take with clients to get them to release?
It's actually really simple in my opinion, but again, it's that being patient with yourself. So once you find a painful spot, and we call it trigger point release or pressure point release, and you might have heard these terminologies, but you might not have received it the way I'm about to say, because I've had these releases to myself. But again, are you feeling after the treatment bruised and sore? Then that means you didn't have the release because you've just triggered more tension. So it's about I call it monk breathing. So you find the painful spot, you breathe into it until the pain melts away. So you should feel an instant release.
Interesting.
Yeah. And they all do. They always do, because I did. And once you find that release, you use it as and when you need it. So, like for example, if I travel to Asia, which sometimes I do, I'll always carry something with me to release it. And, you know, we know about massage balls, and it might be a massage ball. Yeah. So you find a massage ball, you find the spot, breathe into it, a certain type of breathing, melt into it, pain goes away. Right. How long is that giving you relief for? Good. Has it caused you soreness afterwards or bruise? No.
Wow. So the breathing aspect and
it's the biggest game changer.
Is it really?
Yeah. And especially stretching as well. I go, show me your back stretches. They'll do the back stretches, and they're doing it in such a tense way. It's like you're trying to achieve this stretch in yoga because everyone else is doing it, touch the floor, and you're like forcing it all the way down, but that's not the way it should be done.
It's fascinating. I think the mainstream around breathing is coming a lot more prominent nowadays, probably through people like Wim Hof and stuff like that. But I listened to a fascinating podcast by have you heard of the Gracie Jiu-Jitsu family? Have you not? No. Yeah. The name Gracie in Jiu-Jitsu is like, it's the creme de la creme basically. These guys have been around coaching, they've studios all over the world, and I can't remember the name of the guy. There's so many of them. One of them was on quite a famous podcast, and he was talking about how he has been using these breathing techniques in his flows when he rolls. He's constantly kind of having like a very steady inhale, exhale, because it's when you're rolling with someone, it's very easy to tense up and like hold your breath while you're just kind of moving around them. But he's learned to like almost regulate his breathing with every single move that he does. And he was like, it just keeps me in balance, it keeps me focused, it allows me to keep tension out of the body so I can stay loose and placid, I can move around someone like water, like a snake, he was saying. I remember just and he was saying even when he punches the bag, he's going and he's using his hands to punch, and as he's punching, he's kind of letting his breath flow with the punches. And I remember him just explaining this method and thinking, that's fascinating, because we do this a lot, especially in like lifting, for example. Yes, we have to brace, we have to talk about kind of, you know, getting that breath tight to kind of create firmness, but with a lot of things day to day, there has to be looseness, and there has to be breathing, and there has to be a placidness to it. So yeah, I think it was really insightful. That, and hearing you say it just reconfirms that message.
Yeah, so we can get to that breath work and do the release. Yes, when we close our eyes and we're on the floor, we got nice music on, TV on, kids are playing. We can do that, and we're getting that breath. But can you do the breath whilst doing the movements, whilst working, whilst doing the garden, understanding and like how you're holding your breath now? You know, it's about, can we connect it on a day-to-day basis? So once you know the release in that calm setting, that's why I go and take them to deadlift next or squat next. It's like, right, can you brace and then release? Brace and release, brace and release, for that short period of time or a long period of time. So it's
I'm even thinking about like anger management. When you go to anger management, what's one of the first things they tell you to do?
Never went 10 to 5.
I know I have a friend who works in anger management, which is why it popped into my head, and he was telling me about like the breathing. It's like the one thing when people get angry, it's because they've spent like time stewing on something, and during that stewing time, they're holding the breath though. And not breathing properly, like they're holding this pent up energy, and as soon as they just start going big inhale, large exhale, it's amazing how that just calms things down. And I can see why that again relates to stress and pain
especially like when you feel pain or you have a flare up, the first reaction is I've done it again. And you hold that breath, and it's about, if you can do it in the rehab setting, causing that massive pain. You know, some clients say that's 10 out of 10 pain. Be with it, breathe through it. It comes down to 3 out of 10. I call it the pain to pressure or pain to pleasure principle, P to P. So that's my clients. What's P to P stand for? Pain to pressure. Yes, you know the principle. And so it's understanding that. But yeah, you've got a real good point there. It's like, yeah, we can do it in that therapeutic setting, but can we do it in the real life setting? And understanding if you have a spasm, can we breathe through it, calm the nervous system down? Obviously, in a physiological point of view, when you're doing the shallow breathing, you're obviously increasing cortisol in the body, which is a stress hormone. You take the deep and the sympathetic system, which is the fight or flight. You take the deeper breath into your diaphragm. It just calms the nervous system down, the parasympathetic and the serotonin. So it just calms everything down. Using that to your advantage on a day-to-day basis.
I think the interesting thing is knowing that everyone, if you listen to this, you're breathing. Like you can do this right now. And I suppose the main reason why it could work and could be linked so heavily from my own research is it's subconscious, but it's also conscious. Like you can control it, but then subconsciously you just breathe without thinking about it. Like when you're in a meeting or something, or you're sat playing with the kids, you're not thinking about breathing, you're thinking about something else. So it's always happening. But I like how you can bring some awareness to it, and mate, I just love that approach. I think it's wicked.
And I think I developed that through through listening and learning from my own problem. It's like, I heard about mindfulness breathing. Okay, I do the mindfulness breathing. Can we include that into the stuff I'm doing with the breath? So like when I'm sticking my elbow into your bum or arse, and it's very painful, 10 out of 10, the only option you have is fight me or breathe. And I'm telling you to breathe. You breathe, the bum unclenches, the pain goes away. And then once he learns that, then he goes, every time he's going to stay unclenched. It's learning that, So like
it's making like a subconscious thing, like breathing, actually more of a conscious thing. And
only when you need it, because you can't be always thinking about it. It is an autonomic thing. So it's like when you're saying when you're in an interview or just before a podcast, you might do some breathing. In your pain, definitely some breathing, because it's always in your control.
I'm going to spend all week
just breathing.
Just like every week. Going forward now, right, when I'm looking at your podcast, I want to see that belly breathing, that diaphragm expanding, not from the lungs, from the diaphragm.
Okay. I mean, I've read all of Wim Hof's books, and he talks so extensively about this. Obviously, more related to like the cold and stuff, but it's amazing what that heals as a side thing, and how many people he talks about countless stories of like stress and pain and
I have so many lovely clients that have said to me, I've used that breath work and it's helped my pain. Then they just moved house, girlfriend was having an anxiety panic attack, he taught the breath work to her and calmed her down, and I'm like, down to you, mate.
Wow. There you go. Wow. There's a hashtag there, down to you. Which no, it is honestly, mate, I think I'm hoping that's going to be game changing for someone who's listening and thinking, I'd have never thought of doing that for pain management, for stress management, for somebody who might struggle with panic attacks. Just never thought about that type of breathing.
It is a type of breathing, but there's also a technique I show to what I call it cleaning out the closet, so cleaning out the brain. So when you leave your wardrobe on a day-to-day basis, you clean your clothes, you chuck your clothes into the wardrobe, you look at it, it's kind of messy, but it's functional, leave it. And then it comes to spring clean, winter clean it up, shirts are nice and aligned, clothes are nice and folded. You look at your wardrobe and that's lovely and organised. When's the last time we did that with our brains? So there's a breath work for that, and there's also a breath work for gratitude, which is again very easy to do, and I always finish on that. So there's these little things. There is a process I've developed, and I guess it's through undiagnosed ADHD brain that I see patterns, and so the pattern recognition of pain and how to deal with it, I've come up with a program, and then people just follow that program, and I can guarantee, semi-guarantee, within 4 or 5 sessions you know what to do about your pain.
Amazing.
Yeah, the whole message from you having to deal with pain to create a program that, you know, people can go away and use, and they're not relying on you all the time. Like, again, from a business point of view, maybe not the most efficient way of doing things, but people will, I guarantee, will want to keep coming back to you to make sure that it's working, it's there, and they'll forget some of the techniques, and they'll want to keep recapping with you. So and guess what, you know, they're going to help other people are going to want to learn it, they're going to come to you. So
that's the business model, is that they get fixed and they're going to get recommend somebody else, because there's so many people out there with pain, as we know.
Of course.
And
it's like Chinese whispers. People will never be able to tell them and explain it exactly the way you do, and if they want to really learn it and they've seen some of the benefits of it, like the person with the panic attack, for example, if they really want to master that, they'll come to you and say, I want to know what the guy said to the T, because it really works.
And I think it's a message close to my heart as well. Like, my old clients sort of know that when they're ready to offload, I'm just like, right, what do you need to know to not need me anymore? And I feel like you go in with that from the off. And like I said, it's a message that's close to my heart, which I suppose before I ask where people can find Adam, have you got any final questions for Adam?
No, I think we've pretty much covered everything. I think, like I said, you know, our biggest thing from this episode was just to get people understanding pain management better, and it's far exceeded my expectations in terms of where we were going to go with this. I'll be honest, if you told me at the start we were going to be talking about breathing as a way of pain management, I would have been chuckling to myself, but I totally get it and understand it now. So I think, again, thank you for highlighting that, and I do really think it's going to help a lot of people, this podcast, for sure.
Brilliant.
And if we can turn the tables, is there anything that me and Ryan can maybe do with our clients who are maybe suffering with a little bit of pain, or is there anything practically you can give us to do if someone is maybe struggling or they've been struggling for a long time?
You know, I feel like there are some PTs that come referred to me, and then the worry is, and that's the reason why I work in CrossFit, is that what about the membership? Like, if they get injury and then they're going to go, well, I can't really CrossFit anymore, so I'm going to go off. And that's probably why it works really well with CrossFit Kum, is because my philosophy is not to encourage fear. It's to encourage, actually, you can still train with this. And then they train, they keep the membership, and then same with PTs. Like, if you've got a client that's got a grumbling issue, you change and you adapt their movement. So, for example, back issue, you rule out deadlifts. And so you do something else. But then to fully train that person, just get rid of that fear, that issue. I'll refer them back to you, obviously, and then you keep that client and they can fully train them without adapting and changing and feel a lot better. So, yeah, I guess for you guys, if you have any clients that, niggle stuff, and it affects their programming, they come in each week like, I don't think I can do that, let's get rid of that so they can carry on to their full amount. And so you guys don't need to stress over thinking, what can I replace that exercise with, without injuring or damaging their back or whatever issue they have. Let's get rid of that so that you can just program them fully as they can, and they live as much as they like.
What a message. What a message. Yeah.
I said it before, I'll say it again, I think good physios are worth the weight in gold. There really are people who can fix people and get them understanding pain. It revolutionises the way people live. It's quality of life, and you almost can't put a price on that, I don't think.
No.
For sure.
No. Absolutely not. And sorry, go on.
That's why it might seem like it costs a little bit more, but this postie was paying £55 for like 10-15 minutes, and then I'm paying, obviously mine a little bit more expensive, but for a longer period of time, and again for 4 or 5 sessions, and hopefully you know what you need to do. So it's difficult, again, the business side of things.
Which again, if people want to know more about your program and where to find you, where can we find you physically and digitally?
Physically, I'm at CrossFit Kum. Just started some working bands as well at the box. If you're really desperate and really need help and you can't leave your house, I can do home visits too. But generally, I'm statically at CrossFit Kum in Kelham Island. And obviously online, you can see me on Instagram on Down2U Physio. I know I need to change that because of the business name change, and Facebook obviously, but they're the main two resources. I need to start to get on TikTok and all the other crazy stuff.
That's a whole in the world, that, mate. Even I've posted a few things, but yet to master it.
Mate, I'm really impressed. Thank you for your time. Thank you for your insights. And mate, I think this will go down really well. I think you've helped out a lot of people.
Thank you for your time. And
Adam, awesome. Thank you for that, mate.
Thank you, man.
Let's encourage more parents being fit.
Absolutely, 100%. Guys, thank you for joining us on the Fit Dads podcast. We'll see you in the next one.
See you soon.
See you later.
Cheers, mate.
Amazing.
Mate,
Awesome.
I'm so
That's really
impressed.
good.
Appreciate
Thank
that.
you.